Hey everybody, Dr. Roger Sayes here from Wellness Solution Centers. This week our article of the week was all about chiropractic technique and some of the different techniques that we utilize with our patients here in the office. So I wanted to demonstrate a couple of the different things that we most commonly use with all the different doctors that we have in the office, Dr. Dane and Dr. Jerry and myself, and we all use a combination of all these various techniques. Chiropractic adjustments are not a one-size-fits-all. We try to adapt to whoever's on our table at any given moment in time. You know, whether it's we're seeing teeny tiny babies or seniors or anybody in between, chiropractic adjustments are not a one-size-fits-all. So one of the things that we're looking for when we have a patient on the table, we're looking for any restriction in the mobility of the soft tissue in the joints themselves, the vertebrae, and we want to make sure that with our adjustments that we're correcting any alignment issues and for any restrictions that we see. We can find these issues on just by palpating the spine and touching and feeling how everything works and moves. We can see issues, alignment issues and areas that need to be addressed on x-ray as well as posture. So one of the most common techniques that chiropractors utilize are techniques where we make adjustments solely by hand. So generally this is a little bit more of a deeper impulse. It's a more manual technique, but if we find an area that needs to be adjusted on the spine, we can use our hands to make an adjustment, and most commonly this type of adjustment will produce an audible sound, which is pressure and gas releasing from the joint, and we can hear an audible sound. Another technique that we utilize a lot, we have a handheld device that relies on speed rather than force. So if we find an area, whether it's in the pelvis or anywhere in the spine, we can utilize this device to make an adjustment. And rather than one impulse, this is repetitive impulses. And so this will also correct for alignment issues and mobility issues, etc. Another technique that we use is called the drop table technique. This is where the table will act as the instrument as well. So if we're making an adjustment, especially here in the pelvis, I can make an adjustment, correct for the alignment, correct for any of the range of motion issues, and the table will drop and absorb that impulse. We also use a host of other techniques. We do muscle techniques that we can use by hand, trigger point therapy. We also use a handheld device that uses vibration. So if there's any restriction in the soft tissue or if there's any trigger points or muscle spasm, we can use this device to correct for any of those issues. It feels really good and it does produce a great result. So if you are a patient in the office and you have more questions about some of the techniques that we utilize, please don't hesitate to ask. And if you are someone who's new to chiropractic and is seeing this video and wants more information, I encourage you to come to our office, take a tour, and see some of the things that we have to offer to help our patients in need. That is your health tip of the week. My name is Dr. Roger Sayes. Have a great day.